All right. Dr. Benedetto here on another quick video. Those of you who have been following me or seeing a lot of these videos that I cut, I like to just take a few minutes and kind of really celebrate patient wins. Unfortunately, in mainstream medicine, there aren't too many wins to celebrate a lot of times. And so I like to do these kind of quick examples that just happen day to day in our office to kind of show people what's possible out there with the right plan, with the right treatment. Um, and I'm not talking about with the right medications. I'm talking about with the right approach, with the right attitude, with the right dietary work, with the right supplements, with the right lifestyle changes. What is really possible? So this is recent blood work with a patient of mine that I wanted to kind of go over because it's pretty stereotypical. Like it's pretty average as far as like the results that I see with my patients that honestly sometimes we'll have a little my patients will like to have a little fun with their medical doctors because they're usually their lab numbers only get worse, right? So like as they get older, they take more medications and their blood work gets worse, right? And they don't feel better, they get you know, sicker, let's say. Um, Typically in my world with my patients, we want to reverse that process. So I wanted to kind of run through this real quick. And this is a patient of mine, um, autoimmune thyroid patient with it's again, most of you, if you've ever seen any of my videos before, that's kind of my specialty. That's what I work with. And this were just some updated labs that she was having with her primary care doc. And we've been working together for a couple of months at this point. And you know, she has I've run her through a protocol for her with some dietary work and some nutrition and some testing, some individualized testing and things like that to get to the bottom of her autoimmune thyroid condition, figure out all of her root causes, put a plan in place to help get her better. And for to her credit, she's done everything great. Like she's made all the changes, dietary work, supplementation, testing that she's been all in and she's doing great. Like that's the most important thing is she's doing awesome. Like she's feeling so much better. Symptoms are going away. You can see here I redacted all of the information except that you can see this is a 56-year-old female. And these were the tests that were run. And again, I didn't send her for these labs. This was her primary doc. Um, and you can see here there's the current results and then the previous results, which were actually just done in July of this year. So this is a 2 month period. So you're going to see the previous results actually on July 7th, and you're going to see these results, which were from September 8th. So literally you're talking 2 months, literally 2 months, almost to the day. Okay. And we look here and we see a CBC, right? And not too bad, right? Like previously, her levels were okay. They're still okay, right? White blood cells, red blood cells, all these different markers here. That's what these are all for. Previously, she was pretty good. She's still pretty good. No anemias, anything like that. The real cool thing you're going to see is in the metabolic panel and the lipids. Um, so what you'll see here is the metabolic panel. So this is the previous result. So the previous result, let me blow that up a little bit. The previous result on this one was from June. So it's a little over, okay, a little over 2 months, but let's say, 2 months for intense purposes, 2 months and a couple weeks. So these were done in June of 25. These current ones are in September of 25. So her glucose in June was 123. Okay. Anything over 100 would be considered insulin resistant, pre-diabetes, until you get diagnosed with type 2 diabetes. So she's on the way. You'll see when we scroll down here, her H1C was not through the roof yet, but when that glucose stays elevated and the A1C follows, now you're pre-diabetic or you're insulin resistant or you eventually develop type 2 diabetes. So it's a road we don't want to go down, right? So what you can see here is previously she was 123, now she's 89. So her glucose in 2 months, fasting glucose went from 123 to 89. That's tremendous. That's awesome. You can also see her creatinine, right, which is a kidney marker, and her GFR, right? So creatinine and GFR, this is like how your kidney filters, right, fluid, right, filtration rate. So these were out of range. So the creatinine was high, so she had too much creatinine in her blood, so her kidneys weren't filtering it properly. It was 1.15. You can see that's out of range. It went down to 0.90. Excellent. Really cool. Right? Really cool. So her GFR was low, right? So her kidneys were like a little sluggish, let's say, in filtering the fluids, right? Filtering the blood. You can see it's got to be greater than 59. She was 56. Now she's 75, right? Her potassium, a little bit high, a little too much potassium, right? So these are all kidney markers, liver markers, all that kind of fun stuff. These are like organ function. Potassium was 5.3, now it's 4.4, way back in range, right? So this is really cool stuff. So she had these markers showing abnormal function 2 months ago, 2.5 months ago. And we put together a plan to help treat her autoimmune thyroid issue, which at the same time cleaned up all this stuff, right? No drugs, no medications, nothing crazy, right? We did some dietary work, we did some lifestyle work, we did some supplementation, we did a little bit of additional testing to help address the autoimmune thyroid thing. But look at the life-changing implications this can have for this patient. She is no longer on her way to type 2 diabetes. She is no longer on her way to her kidneys not working so well, which we saw some things. They're all normal. All these things went back into normal because we healed her up. We improved her function globally, really. Here's the other cool thing. So that's on the metabolic markers here. Really cool stuff. Um, Now, what you'll also see here too, look at this. Her lipids, right? Every doctor loves to run lipids, right? Her lipids in April, okay, so now this is 5 months, and I haven't even been working with her that long. I've been working with her for like 2 or 3 months since those initial ones. So her previous results, these are her lipids, right? Every doctor in the world looks at these, right? Because they want to put people on statins all day. Her lipids in April, total cholesterol was 231. Now it's 165. Triglycerides, 211. These are high, right? I mean, the total cholesterol is not ridiculous, but it's 231, and now it's 165. That's great. That's awesome. I love that. That's why I do this stuff. That's why I do these videos. Like, this is awesome. You guys got to see what's possible with a different approach, right? Because if she didn't find me, she's just going down the medical path, and this stuff just keeps getting worse, and wheels keep falling off the bus, right? And you just here's more pills, not fixing anything, right? This is awesome. This is why I get up in the morning. This is what I want to see. Her triglycerides went from 211 to 73, gang. 211 to 73. How cool is that? Her the LDLs, right? That's classically your bad cholesterol, right? Went from 133 to 98. 133 to 98. Not exactly where we want them yet, but that is a tremendous drop. These are your bad cholesterol, right? And everything else was okay. You can see your hemoglobin A1C was 5.5 in April. Now it's 5.4. So that's great, right? So you can see here these markers, like when that glucose stays elevated, which it was at 123, the A1C over time, if that stayed elevated, the A1C over time would have followed suit. So you can see between 5.7 and 6 is considered pre-diabetes, and then type 2 diabetes is considered greater than 6.4. So while we can't say for sure, we can say with a pretty good guess that her glucose stayed elevated, that A1C is just going to keep going too. She's going to be pre-diabetic. She's going to be insulin resistant. There's a chance she could develop type 2 diabetes. So we kind of nipped that in the bud, right? And she's feeling great. Like she's doing awesome. Like all the stuff she came to me with, this laundry list of symptoms are all getting better. And we want to see the labs, right? The evidence of what we're doing follow suit. We want to see the things that aren't looking so hot that are indicating abnormal function, or that's a reflection of what things that aren't going on well in someone's body. We want to see them all improve. And this was super cool one. Like I see this every day, but I wanted to shoot this quick video and fire it out there. And gang, listen, these things are possible. um, this is objective evidence of the things that we've been doing with her treatment wise that's making her feel better, actually make her body work better. And all of these alarm bells going off in her blood work previously are now all better. Almost overnight. We're talking months, right? The body will heal. The body can heal. We got to give it the right stuff. We got to do the right things for it. So hopefully you guys found this as cool as I did. Like I see this stuff all day, every day, and I still love it. I love it. It just reinforces the work that I'm doing and the work that I'm doing with my patients, and I love it. And I hope this was helpful. If anybody has any questions on this, um, let me know. Entirely doable, and just a terrific reflection of all the work she's put in and the commitment she made to her health. And we're seeing it in her improvement day to day, in her symptoms and how she feels and how her body's functioning. But now we're also seeing it in just months. It doesn't take years, gang, months. We're seeing gigantic swings in these major markers that all doctors look at that were all not good, that are all significantly improved. So, pretty cool stuff. Any questions? Let me know.